Good afternoon, everyone. My name is Ashley Clark, and I'm Press Secretary for the COVID-19 Vaccine Task Force. Thank you all for joining us, and I will be the moderator for today's media briefing. We are joined by Dr. Sohail Sood, who serves as the lead of the COVID-19 Schools Guidance and Policy Team at the California Department of Public Health, and Bruce Allen, who is the Executive Director of the California State Board of Education. I am also joined today by my colleague, Yarina Malara, Multi-Ethnic Press Secretary for the COVID-19 Vaccine Task Force. We have allocated time towards the second half of our briefing today for Yarina to provide announcements in language for the Spanish media outlets that have joined us today. As we all know, COVID-19 is still present and remains highly transmissible, especially with newer and more contagious variants circulating. Parents and families may have questions about returning to school safely, and we are here today to answer those hard-hitting and frequently asked questions so that everyone can start the school year feeling prepared and informed. August is also National Immunization Awareness Month, which offers an important and timely reminder on why vaccinations, like the COVID-19 vaccines, are critical tools to help keep families and communities safe from disease. During today's briefing, we will be discussing the return to school from summer break and ways that children, parents, and teachers and staff can protect themselves and their loved ones. For those members of the media that are present, please submit any questions that you have via the chat feature on Zoom. We will address these questions and let the panelists answer them at the end of the call. I also recognize that folks may have questions about other health issues like monkeypox. While the Department of Public Health is keenly focused on that as well, today's briefing will be focused on COVID-19 and our kids' safe return back to school. Public health questions outside of today's topic can be submitted to the CDPH media team at cdphpress@cdph.ca.gov. And just before I turn this over to our speakers, the COVID-19 Vaccine Task Force would like to take a moment to commend California's school leaders, teachers, staff, students, and families for their continued vigilance. Vaccinate All 58 urges everyone to continue to practice preventative strategies and embrace mitigation measures when and where recommended to ensure we keep students safely in school. And with that, I will turn it over to our first speaker, Dr. Sohail Sood. Dr. Sood?
Thank you so much, Ashley, and good afternoon, everybody. As mentioned, my name is Sohail Sood. I am a pediatrician. I care for newborns and hospitalized children. I'm the father of two wonderful school-age kids, and I lead the COVID-19 Schools Guidance and Policy Team here at the California Department of Public Health. And today, I will be providing you with a few updates about the status of COVID-19 in our state and how California has been steadily preparing for the start of this school year. And so, starting with the epidemiology, as you all know, and as Ashley just mentioned, we are currently facing the most transmissible variant of the SARS-CoV-2 virus we have ever seen, the BA.5 subvariant. And while official data indicate that more than 15,000 Californians are infected daily with this virus, we recognize the true number of infections is likely far greater due to unreported results from at-home tests. That said, the use of these at-home tests is a really good thing. The ability to know your status immediately and make decisions accordingly is vital to curbing the spread of COVID-19. And we'll talk more about these tests in a minute. In terms of hospitalizations, there are more individuals with COVID-19 in California's hospitals right now than there were a few months back in the spring. And while there are some signs that hospitalization rates may be waning, which is welcome news, overall, it does look like COVID-19 is with us for the foreseeable future. So that's the backdrop. But all that said, as we start the 2022-23 school year, it's important to note we are in a very different place than where we were a year ago. Yes, this virus continues to evolve and circulate and make people sick, but we have gained a number of methods and tools to decrease its impact on our health and well-being. And so, as students and staff return to the classroom, we're here today to emphasize that California schools can manage this disease in a sustainable and adaptive manner, in alignment with the state's smarter plan. And so let's talk more about that. The state's COVID-19 guidance for K-12 schools was released on June 30th, and it is rooted on the principle that safe in-person instruction is critical to student well-being and development. For the vast majority of students, my kids included, being in that classroom is vital. It's where they thrive. And being there safely means continuing to focus on a multi-layered protection strategy with recommendations to get vaccinated, to focus and pay attention to indoor air quality, to use a mask, to get tested, and to stay home when sick. None of these measures is fail-safe, but following this layered strategy will make California schools among the safest places for all to be this fall. And just to focus on a few of those measures a bit more, the vaccine continues to provide robust protection against severe outcomes. And let's remember that at the start of the last school year, 12 months ago, we didn't have COVID-19 vaccines available for anyone under age 12. Today, not only can children as young as 6 months old receive protection, but those 5 years and older can get boosted. And so we're encouraging everyone eligible, especially students and staff, to get up to date on your vaccines. And you can visit myturn.ca.gov to find a vaccination site near you. And to schools, we are more than happy to support you. We'd be delighted to support you if you're interested in hosting a mobile vaccine clinic. Visit our website, schools.covid19.ca.gov, to learn more about those opportunities. And on testing, at the start of the last school year, at-home tests for COVID-19 were exceedingly difficult to come by, if at all. This has improved substantially, particularly in California schools, due in part to the state making this a priority. And so what I'm pleased to announce today is that as a part of the Smarter Plan, California has been working closely with county offices of education up and down the state to pre-position more than 10 million over-the-counter tests in preparation for the start of the school year. Of that amount, more than 9.7 million at-home tests have already been delivered to counties over the past 3.5 weeks, and another 1 million are en route. We have also been coordinating with the CDC over the past several months to deliver an additional 6 million tests to schools and summer camps between the months of April and June. And when combined with the at-home tests provided to schools last year, that brings the total number of over-the-counter tests distributed to schools in California to more than 47 million tests. And so we're asking for your help today in getting the word out to all students and staff to use these tests in the days before they return to campus. After a summer of really hopefully being with friends and family and relaxing a bit, before stepping back into the classroom, we're encouraging everyone to get to know their status and to protect one another. Instructions on how to use these tests are available on our website, again, schools.covid19.ca.gov. And furthermore, as we march into the school year, with support from our federal partners, California anticipates being able to provide more at-home tests directly to school districts and charter schools on an ongoing basis. More information on this will be forthcoming, including how school districts and charter schools can request shipments of these tests. So stay tuned for more on that. And I'll just note that we are well aware that there are other places where one can get an at-home test, and that is wonderful. But just as you come to school for a warm meal or to receive other essential services when they're not possible to find elsewhere, we're encouraging schools to serve as this testing backstop so that their students and staff can access at-home tests and protect one another as we all collectively transition back to school in this next chapter of the pandemic. And so to summarize, the main messages for school communities today are: 1, let's all ensure we're up to date on our COVID-19 vaccines, and schools can reach out to us for support in hosting a mobile vaccine clinic. And number 2, let's get tested before we return to campus. And in support of that goal, California has been working with county offices of education to pre-position more than 10 million tests for use in school communities. So thanks for your time, and I'm happy to take questions after.
Thank you very much, Dr. Sood, for your time today. And next we'll turn to Brooks Allen. Brooks.
Thank you, Ashley. And thank you to the Vaccinate All 58 team for hosting this really important and critical conversation. My name is Brooks Allen, and as Ashley noted, I serve as the Executive Director of the California State Board of Education. And also, building on Dr. Sood's introduction, I am the proud parent of a 7th and 9th graders. I will be returning to school next week and are paying attention to everything that Dr. Sood just laid out. As we see students and staff returning to classroom, it's only natural that questions are going to arise, which is why this conversation today is so critical and why we're seeking to ensure that the information Dr. Sood just shared reaches all administrators, teachers, school staff, families, and students all across the state, and as part of an ongoing outreach campaign that we've been conducting as schools start up. We are, as Dr. Sood mentioned, all very grateful to the school leaders, teachers, staff, families, and students who are continuing to exercise vigilance and to urge everyone to continue to embrace the key mitigation measures Dr. Sood discussed when and where recommended to ensure our core goal is met, which is that we are keeping our students in school safely. Never are we better than when we are all working together. And this has certainly been the case when education and health agencies have partnered together to save lives and advance health. In the early days of this pandemic, during those days that we all remember all too well, in March of 2019, I was working at the local level, and will always remember our local public health officer highlighting the World Health Organization's definition of health when discussing the joint efforts that educators and doctors were making at that time and have continued to make ever since that day, right up to, and as Dr. has been laying out, into the future. And those are really the efforts to serve the students in our communities, particularly those who face the greatest risks and challenges. As our local public health officer explained, health, according to the WHO, is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. I think that definition captures what all of us across all sectors are seeking to achieve for the children of California as they enter the classrooms this fall. Thank you, and we look forward to the discussion.
Well said. Thank you, Brooks, for lending your perspective. Next, we'll turn to my colleague, Yarina Melara, Multi-Ethnic Press Secretary for the COVID-19 Vaccine Task Force, to provide remarks in Spanish. Yarina?
Thank you, Ashley. Hola a todos, un placer estar aquí hoy con ustedes. Como parte del Plan Smarter, hemos estado trabajando en estrecha colaboración con la Junta Estatal de Educación y las diferentes oficinas de educación de los condados para asegurarnos que todos nuestros niños inicien el año bien. Hasta la fecha se han entregado 9.3 millones de pruebas caseras a todos los distritos escolares durante las últimas 3 semanas y sabemos que alrededor de 600,000 van en camino. California también se coordinó con los CDC para facilitar el acceso a otras 600,000 pruebas de pruebas caseras para las escuelas y campamentos de verano entre abril a junio de este año. Es importante señalar que actualmente enfrentamos la versión más transmisible del virus SARS, COVID-2, que hemos visto hasta el momento en los 2 años de pandemia. Sabemos que los casos confirmados no reflejan a todas las personas contagiadas y queremos decirle a las personas que hacerse la prueba casera a nosotros y a nuestros hijos antes del regreso a clases es fundamental como una medida para identificar los contagios y evitar que el virus continúe circulando en nuestras escuelas. El virus todavía está causando que las personas sean hospitalizadas. Eso es importante señalarlo. En general, las admisiones son más elevadas en comparación con la primavera, pero parece que todo podría estar disminuyendo. La estrategia para el regreso a clases tiene 3 componentes importantes. 1, hay que vacunar a nuestros hijos y si ya los vacunamos hay que darle la dosis de refuerzo. 2, hay que utilizar mascarillas y el número 3, es muy importante que dejemos a nuestros hijos en casa si se sienten enfermos o si presentan algún síntoma. Le hacemos un llamado a los padres de familia para que así como se aseguran que sus hijos tienen todos los útiles escolares que necesitan para el regreso a clases, se aseguren también de vacunarlos contra el COVID-19 o de ponerle la dosis de refuerzo. Y bueno, y recomendamos también fuertemente que se utilicen las mascarillas. Visita myturn.ca.gov para encontrar un sitio de vacunación cercano. Y para las escuelas interesadas en albergar una clínica móvil, también pueden visitar el sitio web, especialmente para las escuelas, llamado schools.covid19.ca.gov para más información. Aquí voy a estar para las preguntas en un rato. Thank you, Ashley.
Thank you so much, Yarina. And as a reminder to folks, we are recording this briefing and we'll be able to send it out to everybody after the briefing. So just to answer a couple questions that came through the chat. So also now it is time to ask your questions. So if you please go ahead and send your questions in via the chat feature and we'll ask our panel of experts to respond. I believe we may have a couple already. And this question I think is for Dr. Sood. How confident are you that the at-home test can detect the BA.5 subvariant? There are some reports that it is unable to do that. Would you mind answering that question, Dr. Sood?
Yeah, absolutely. Thanks so much for the question. So we remain really very confident that the at-home test will detect the BA.5 subvariant. In fact, there have been some very recent studies in collaboration with our academic partners corroborating that information. So it's a very important question. We have to stay on top of the data and ensure that all of our testing is able to detect the variants that are circulating, but at this point we do. And I'll just note, the test is really a proxy for infectiousness, not necessarily for symptoms. And if you are symptomatic, we've always recommended testing multiple times. And what we are noticing, this is rare, but sometimes happens, for those individuals that are vaccinated, sometimes the immune system revs up and you get symptoms before you're actually infectious. It's the symptoms due to the immune response more so than the disease itself. And so overall, we remain quite confident that they work well. We're aware of some cases in which multiple tests are needed to really pick it up. But again, they're a proxy really for infectiousness, not necessarily for symptoms.
Very good. Thank you for that. Another question that came in, how many school-age children have been vaccinated?
Great question. I will direct you, and we can do this perhaps after the chat, to our websites where we have the data live, really that's updated on a regular basis, and that's sorted out, by various age groups. So you can find the exact numbers there. But the overall answer to that question is not as many as we'd like. I think we need to continue to do our work, and that's why we're here talking to all of you today to see what we can do to increase those rates and protect children. As mentioned, I'm a practicing pediatrician, and I still see children in the emergency rooms and in the hospitals who are getting this disease and requiring various levels of respiratory support. So more work needs to be done, but we're getting there. And so I appreciate all of your support with it.
Thank you. And I'd like to allow a moment for Yarina to provide her answer, but in Spanish.
Sí, esta pregunta la hizo Mireya. Mireya, el doctor lo que dice es que las cifras se están actualizando constantemente en el sitio web y ahorita estoy viendo en promedio, estamos hablando que un poco más del 50% de los niños en edad escolar han sido vacunados por lo menos con la primera dosis. Cuando hablamos de latinos es un poco más bajo, es alrededor de 1 de cada 4 niños en edad escolar. Thank you.
Thank you. Okay, let's see, another one from Fox 5. Along with COVID-19, monkeypox is on the minds of many parents in California. Is there a concern about the spread of monkeypox in schools as the school year starts? And what is the plan in place?
Yeah, thank you for the question. I think as Ashley mentioned at the top, today we do want to focus on COVID-19, but very briefly, let me just start by noting that monkeypox and COVID are 2 very different viruses. Right. And all available evidence really suggests that the monkeypox virus is far less transmissible than COVID. That doesn't mean it's not of great concern. It is, but understanding those transmission patterns is really important to determining risk. And so monkeypox is spread primarily through direct and sustained physical contact and often intimate contact. So given the route of transmission, the risk to the general population remains very low. And that includes children in schools. So Californians really should be aware that the monkeypox virus is here, know the symptoms, and know how to protect themselves. But the focus right now is on those most severely affected, which, as you know, are individuals in the LGBTQ community engaged in male-to-male sexual activities. So that's where the attention needs to be, and that's where the resources are going. And maybe I'll also note that on that topic, we need to outright condemn homophobia in schools and everywhere. With COVID-19, xenophobia and anti-Asian sentiment only serve to harm the communities impacted. And so hatred and fear do not slow down viruses, information and resources do. And that's our focus and attention. So we're constantly reviewing the new data and research, and we'll keep you all informed. But at this time, schools and childcare settings appear to be very safe places to be.
Thank you so much for addressing that, Dr. Sood. Okay, let's see. Another question that came through is, will schools be requiring masks and or vaccinations?
Sorry about that. Yep, happy to take those. And we'll start with vaccinations, then we can talk about masks too. So with vaccinations, as many of you may know, a few months back, I want to say maybe February or so, the governor previously stated the conditions upon which one would consider a vaccine mandate in schools. And one of those conditions was that it would go into effect no earlier than July 2023. And so the focus right now is August 2022. We're happy to revisit that topic again at a later date and time, but there's no anticipated vaccine mandate occurring during this school year. And with regard to a mask mandate, similarly, there's no current plans to institute a mask mandate at this time. We're always reviewing the data and looking at, number of cases, hospitalizations, and the severity of disease. But as I mentioned at the top, with hospitalizations cresting and coming down, there's no current plans to reimpose any requirement in schools. That said, remains a strong recommendation to use one and to wear a well-fitting mask at that. And we continue to affirm the right of local health departments and local educational agencies who know their communities, who understand transmission patterns in their school settings and in their community settings. We affirm the right for them to make some of these decisions and to impose stronger recommendations and or requirements in their context.
Fabulous, thank you. One more, will the school have a close contact tracing system in schools this year?
Yeah, great question. And I suppose part of that really depends on the school itself. I can tell you our guidance remains to participate in some degree of contact tracing, not nearly the level of tracing that was recommended at the start of last year, but similar to the recommendations at the time at the end of last year. And to just be a little bit specific around those, currently the recommendation for students as well as for the general public is if you've been exposed to COVID-19, you should wear a mask and get tested 3 to 5 days after the exposure. And the only reason you're going to know to get tested is if you've been notified you've been exposed. And so that's the reason and the impetus behind the contact tracing there is to understand that you've been exposed. And so we are asking for parents to notify schools if their child was infectious and on the school campus and tested positive for COVID-19. And then in turn, we are asking schools to notify those exposed to that student or staff member of that exposure so that, again, those individuals can go ahead and get tested. There's more details around those exposure notifications and in our website, schools.covid19.ca.gov, and happy to put some links in the chat if that's helpful.
I believe Brooks Allen has already beat you to the punch on that.
To it. I appreciate
it. So thank you for that, Brooks.
Of course.
Awesome. Okay, so we did also have a couple of questions come in Spanish. I have a translated version here. There's concern among some teachers and school workers because COVID tests are no longer being required every week. How is this possible when we still have a high level of COVID infections?
Maybe just a few nuances to tease out there. One to mention is that there is still in current effect the State Public Health Officer Order of August 11th, 2021, which is a requirement for the school workers who are not fully vaccinated to undergo once weekly testing. Details of that order and the definition of some of those terms can be also found on our website there. So that's part of it there. But to the broader concept around testing and mitigation in schools, I think what you're seeing in our approach this year is a transition, right? To move slightly away from more requirements to a collective understanding that we all bear some responsibility in protecting one another. And so what we've been doing is providing education, providing information, and providing resources, and encouraging all to follow the mitigation practices in place, and recommending that all do so.
Thank you. Yarina, would you like to kind of summarize Dr. Sood's remarks?
Yes, I was taking notes, so I was paying attention. Okay, lo que dijo el doctor es que sí se requiere que se hagan el examen una vez a la semana a los trabajadores que no han sido vacunados. Este todavía es un requerimiento y también que es responsabilidad de todos. Nos hemos movido de un mandato a un requerimiento y con la idea de que es responsabilidad de todos cuidarnos. Okay, I did it. Thank you.
Well done. Thank you so much. All right. Another question that came through the chat. Is there a percentage of population with COVID that if you hit would change current schooling practices? So would anything change those the requirements in schools?
Yeah, great question. So there's no specific thresholds that we are using to determine prescribed actions about what may occur. But that said, it's important to follow trends, right? To look at what's happening in terms of case rates in a community, testing positivity, hospitalizations, and pediatric hospitalizations at that. And as part of that, and thank you, Brooks, for putting into the chat some of these important links here. We are encouraging schools to communicate with their local public health authorities around cases in schools and around outbreaks in schools and around reporting in general. And so that's the first line of really ratcheting up the levels of mitigation in schools, is noticing the trends that are happening and working with your local health departments, and in some cases with us, to see what we can do to abate any emerging trends that are concerning.
Thank you. And I just want to double check with you, Yarina, if there are any other questions that came through in Spanish that I may have missed.
No, I don't see another one in Spanish, but thank you for checking in.
All right, great. Well, that looks like all the questions that we have received, and brings us to the end of our briefing. As Yarina added to the chat, we will be distributing this recording today to everybody that we sent out the advisory to earlier. And I just like to take a moment to thank everyone very much for participating and coming and being involved. Since we are now at time, again, thank you for joining us, especially Dr. Sood and Brooks Allen, for your valuable insight. And yes, we'll close the briefing with that. Thank you, everybody.
I would like to add one thing. I put my email on the chat. All those media that really need it like right away, I can have the recording within the half hour. So email me. Thank you.
Fabulous. Thank you. Thank you, everybody.